Okay, good morning, everyone. Good morning. Yeah, let me have your attention, please. So we're ready to start. And I can request Nelly to open for us with a word of prayer. We also have some of us joining online. I hope they can hear and follow us. We will begin with a word of prayer. Amen. Thank you, Nelly. So I take this opportunity to welcome all of us for today's sensitization. We have staff who are here. We also have students who are joining us online, as well as some staff. And let's make it interactive. Let's engage with the doctor, and so that we can gain something. So I'll hand over to our team from Avenue Healthcare. They'll introduce themselves and just proceed with the presentation. Thank you.
Good morning. My name is Lois Maina from Avenue Healthcare, and with me is Dr. Claire. We're so happy to be here today. Thank you for inviting us. And we're here to give you a talk on drug abuse and mental well-being. So we hope you're going to learn something and you're going to ask as many questions as possible. And yeah, we are here for you today. So after Dr. is through, I'll just tell you more about Avenue and where we are located, so that once you need treatment, you can be able to access any of our facilities that are near you. So right now, I'll welcome Dr. Claire, who is going to proceed with the talk. Thank you.
Good morning, everyone. So my name is Dr. Claire, and I'll be giving a talk today on mental health, as well as drug use and abuse. So what is mental health? So the first thing we need to know is what health is. So health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. In other words, just because you don't feel okay, it doesn't mean you're okay. So under health, we have the mental health component, which includes our emotional, psychological, and social well-being. It affects us in terms of how we think, feel, and act. It also helps determine how we handle stress, and how we relate to others, and how we make our choices. So wellness is the interactive process of becoming aware of and practicing healthy choices to create more successful and a balanced life. So one needs to know and understand how to become well before you are well. So a positive state of mental health is very important, because in absence of this, you have now the mental illness. So being mentally well means that your mind is in order and functioning in your best interest. So if you're able to think, feel, and act in ways that are that create a positive impact on your social and well-being, then we can clearly say that your mental health is okay. So what is a mental illness? So in mental illness, we have patterns of thinking or behavior that will cause a person to have significant emotional pain, and this will prevent one from functioning normally. It is important to know that illness is a disease or period of sickness affecting the body or the mind. So what are some of the general causes of mental illnesses? So one of the most significant things that we have currently is that we have a genetic component towards it where people inherit traits. And then apart from that, we have negative life experiences that will tend to have an effect generally on your mental well-being. Apart from that, we have environmental exposures that will occur before birth. So this is during the period where the mother is pregnant. So some of the exposures that they experience might indirectly affect the unborn child. Then we have viruses, toxins, alcohol, or drugs. So this can also be associated with the point that I just made about the mother. So if the mother has been consuming some of these drugs, that might in a way affect the unborn baby. Then the other cause is brain chemistry, and here the most important factor is where we have various imbalances in your hormones. So what are some of the types of mental illnesses that we come across every day? So we have psychotic disorders, with a good example being the schizophrenia. Then we have mood disorders, and this is where we have the bipolar disorder and depression. Then we have anxiety disorders, where we have the various anxiety disorders, under which we also have the panic disorder. Then we also have personality disorders. So what are the characteristics of good mental health? So what the first basic one is where one is able to feel good about themselves, and then one feels comfortable with other people and has fulfilling relationships. Being able to meet the demands of life, is productive in daily activities, and one expresses in their emotions in healthy ways, and being optimistic. So with the good characteristics, how do the good characteristics have an impact on your mental health? So one is able to express their stressor or anger in an appropriate way. One is able to make a good decision, and they are able to have the conflict resolution. Apart from that, how do they cope with any changes or stressors that come by in their everyday life? Then being assertive is also a good characteristic, being an active listener, and being part of a team or a group. So the opposite of what I said will now fall under the poor characteristics. So we have where one wants to talk about, you did this. So they like blaming or escalate a small issue into a huge issue. Then being aggressive and passive, being depressed, one who runs away from conflict, if they're close-minded, and if one needs to run the group, they want to be in control of everything that happens around them. So when one comes to us, what are some of the common signs and symptoms that we see that will make us know that you have a poor mental health? So they'll come feeling sad or down, and this is basically more or less a depressed mood. They have confused thinking or reduced ability to concentrate. They will have excessive fears or worries or extreme feelings of guilt. So with the extreme fears and worries, that is where your anxiety comes into place. With the extreme feelings of guilt, that is where depression comes in place. Then we have extreme good mood changes of highs and lows. So they can have an elated mood or a depressed mood. Then we have withdrawal from friends and activities. So these are features of depression. Significant tiredness, low energy or sex drive changes. Then we have excessive anger, hostility or violence, and suicidal thinking. Then apart from that, and some of the things that people may not know, that sleep is also one of the key things that we see one having a problem with when they have a mental illness. So they might either sleep a lot or sleep less. Then we have detachment from reality, where they have delusions. They can have paranoia or hallucinations, and the hallucinations can vary from visual to auditory. So visual is where they'll say they see someone that someone else is not able to see, or auditory where they say that they hear someone talking to them or people conversing about the patient that no one else can actually confirm. Then we have inability to cope with daily problems or stress. Then we have trouble understanding and relating to situations and to people. Then we have the problems with alcohol or drug use, which is what we're going to cover mostly today, and major changes in eating habits. So maybe you may find out that you're either gaining weight or reducing. And this also depends on, and people tend to move towards, or if I'm losing weight, I'm sick. They're looking for a physical cause, when actually the main root of the cause that they have is in their mental health. So the WHO mentioned a few things on mental health awareness, and they said that the prevalence of lifetime mental disorder globally ranges from 18.1% to 36.1%. If you look at this is more than a third of the world's population. So it has been noted that there's a huge burden in the sub-Saharan Africa, with 14.3% of children suffering from a mental problem. It is estimated that 11.5 million, which is approximately 1 in every 4 Kenyans, has been noted to have a mental illness. And WHO again, which is the World Health Organization, for those wondering, estimates that 60% of the people attending primary healthcare clinics have diagnosable mental disorder. So why should we focus on mental health awareness? So one of the most unfortunate things that happen is people end up committing suicide. And this is because either they are not followed up as they should, or they are going through something and they don't know who to go to. So one person commits suicide globally in every 40 seconds. This is according to the World Health Organization. This makes suicide the 4th leading cause of death in people aged between 15 to 19-year-olds globally, and this is as of 2019. So we should expect an increase in this given that we went through COVID, and this greatly affected our mental health generally. So every year, 703,000 people take their own life, and many people attempt suicide. And Kenya is currently ranked as 29th globally for suicide mortality rate. And note better, it's only a half of those affected that receive treatment. And why is this? This is why we are actually here today, that the mental health awareness has not yet reached out to everyone. So untreated mental illness results to losses, high medical costs, unhealthy relationships, poor performance, and suicidal ideations, and death, among others. So what are some of the forms of treatment and care that we undergo? So the most basic thing is the lifestyle changes. And this is where we try and work on our sleep. We need to, we basically try to improve the patient's sleep pattern. Then apart from that, diet also plays a role, whereby you need balanced nutrition and water. And this is basically because what you eat in a way will affect your hormones. And remember, I mentioned earlier that hormonal imbalances is one of the causes of mental illness. Then exercise is also good, because with exercise you have release of some of the neurotransmitters that are actually important when it comes to our mental health. Then we also, under lifestyle changes, we also work on the thinking patterns, where we teach one to be more realistic, open-minded, and maybe to allow them to give themselves a bit of credit and not blame themselves. So this is basically praising and helping one acknowledge themselves. Then social support is also a very key thing, because one of the things we see is that for a patient who is undergoing a mental illness, they may feel that the people around him or she don't get to understand what they're going through. And that is why one of the key things they tend to do is withdraw from the relationships that they have. Then we have stress reduction, where we teach them how to cope with the stressors that they get in everyday life. So all these things, like the stressors, like stress reduction, we now come into the psychotherapy. So that is where psychotherapy comes in, that we now have sessions with them where we now teach them the various coping mechanisms that are there. Then for the support groups, that is what we do to enhance our social support. Then there are illnesses that will require one to be on medication indefinitely or for a short period of time. And then we also have rehabilitation for those people who are taking drugs and want to stop. So how do you manage stress? So the first thing is usually one needs to acknowledge that they actually have a problem. Once you acknowledge that you have a problem, then from there you'll be able to go and seek help. So, and this is where you go to a doctor or a therapist. So by doing this, you initiate by starting the conversation, and this is basically how you begin your journey into bettering your mental health. Then one should also be observant, and this is basically what I'm saying. You need to be observant enough for you to realize when you have a problem. So it is important for you to pay attention to your body's responses to stress. Then you also need to find a balance, a work-life balance. So there are 6 easy ways for you to improve on this. You need to donate your time, expertise, or finances. You need to plan your vacation and days off in advance. You need to take time to rest both mentally and physically. You need to find a mentor to provide advice and insight. You need to prioritize your top tasks and do them fast. So, and this is what I'm showing there on the Eisenhower matrix, where you need to categorize what is urgent, what is not urgent, and what is important and what is not important. So you'll realize the green category where it says do fast, that that means that the matter at hand or task at hand is urgent and important. Then the do later might not be urgent, but it is important. Delegate is urgent but not important. Then eliminate means that it is not urgent and it is not important. Then the last way to improve your work-life balance is add exercise as a part of your daily routine. So for anger management skills, as I said earlier, it is important for you to recognize your anger early. Then once you identify that you have it, you need to identify what triggers it and what are the warning signs. Then after that, you need to take a time out, go find someone and talk to them. And while talking to the other person, it is important for you to exercise the following things. Deep breathing is usually a good mechanism to try and calm you down. Then we also have muscle relaxation techniques. Exercise is also noted to be an important way for you to also work on your stress. Then you need to also find a way to express your anger in a way that one is able to understand. And you also need to find a way to communicate it in a way that doesn't make you come out as a bad person. Then you need to also now reframe your thinking. If you find yourself in a situation and you realize that things are not going well, you also need to just step away from the situation and take time to think about what is going on and to relax. So there's a strategy that we use for stress control known as the ABC strategy, where A is awareness. So what causes you stress and how do you react to that? Then B stands for balance. And this is where you realize that there's a fine line between positive and negative stress. And now you need to realize how much can you cope with it, the positive stress, before it becomes a negative. Then C is control. So what can you do to help yourself combat the negative effects of stress? So this is where you bring in your deep breathing and muscle relaxation techniques. So it is important for you not to just look at yourself, but also look out for your neighbor or friend. Just check up on them, because with time you'll be able to realize if this is someone who actually needs help. And it is always good if you're there to just start the conversation and maybe find out, how are you doing? Of late I've noticed this and that. Are you okay? Those are some of the things that our patients really need to hear. Because again, remember I told you that when one is going through something, they tend to withdraw. So if they realize that they're getting some form of social support, then that will go far and far away into helping them now get better with time. So what can we do to prevent stress? So the most important thing over here is to identify the trigger and avoid it. Then it is also important for you to know what you can fix, what you cannot fix, and what you can do to avoid the situation. So fix what you can fix and accept what you cannot fix, which is the inevitable. Then now you for prevention, you now protect yourself from the physical effects that come with it. So, in summary, there's someone there that I cannot pronounce who said that God grant me the serenity to accept the things that I cannot change, courage to change the things that I can, and wisdom to know the difference. Asanteni. Do you have any questions? Yes. Mm-hmm. Yes. So basically, inherited traits are what we find in the genes. So I wouldn't exactly tell you what gene, because you have to undergo some form of testing for us to identify them. Yes. But the most common thing that you will realize is that every time you find a patient, the one thing that you tend to ask them is, do you have anyone else in your family that you know that might have gone through the same problem? And it comes down to even the most basic things like alcohol intake. You might find out that my patient comes from a family where maybe the uncle, the aunt, the grandfather, they used to consume alcohol, and maybe it wasn't such a huge problem for some time, or maybe they will not share what they were going through. But now comes in a patient who is in so much distress, secondary to taking alcohol, and no one will ever think that, okay, maybe the fact that my uncle has also been taking alcohol, there might be something that, it's basically just trying to break down the misconception of your familiania walevi, those are some of the things that we want to try and the kind of thinking that we want to try and change. It is a high time that people realize is those things that people tend to say, it's not true. There's usually like a connection. Yes. Mm-hmm. Okay, so oh, I'm sorry. So the first question was on inherited traits, which is what I was able to answer. So the second question is on where can one find a support group. So I think Lois will be answering that question when she's doing her presentation. Yes. 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 So ideally, one should have sleep for about 7 to 8 hours. But then again, it varies from person to person. At the end of the day, you need to know the amount of sleep that your body requires for you to now know that maybe if I am sleeping less than my 7 to 8 hours, that might become a problem, and it is something that I should address. Because it is true, there is a person that you'll find that sleeps for like 4 to 5 hours, but they are very much okay. But for you, you get to sleep for those 4 to 5 hours and you're a 7 to 8 hour person, that becomes a problem. Mm. So we have a question on positive stress. So a good example of positive stress. There are people who work better under pressure. So I don't know whether there is a relation. Yes, it can be a stressor, but a stressor that gets them through whatever it is, the task that they're supposed to perform. But with time, you realize that working under pressure with time might now change and become a negative stressor. And this is where you find, for example, maybe I have a deadline to give in my work on Monday morning. So I think a positive stressor will be one where I know, if I work last minute, I will still make it and I will do a much better job. But you realize now this can become a negative stress whereby maybe it will push the person not to sleep enough through the night because they were up doing the work. So that is when you can clearly say that they have a positive stress that is now becoming a negative stress, or rather a stressor that is now having an influence or an effect on their well-being. I don't know whether... Yes? We have a question on whether we have medical remedies that are good for sleep and if it is okay to use that. So, yes, we do have medications that people use for sleep, but it is usually advisable for us to... There's like a ladder, if I can put it that way. So at the bottom of the ladder is where we start with the lifestyle changes. If we realize that this is not working out for you, then at that point, we might want to now consider bringing in the medication, but not the other way around. So in the case of sleep, some of the things that we look into is, how is your sleep hygiene? Do you have like a strict pattern where you know you're supposed to be in bed by 10 p.m. because you know you're supposed to wake up by 6? That's an example. Then how is the environment around you? Are you the type of person who takes your phone to bed? So until we rule out all these factors and try and change them and realize that this is clearly not working, we wouldn't want to add the drug. So that the medications will definitely come in, but now after we have tried these other methods and it is not working out. Each and every single drug, from the basic painkiller that you buy mara moja, has a side effect. Yes. Any other questions? Yes?
What should an organization start or stop doing? That's the
So we have a question on what an organization should stop or start doing to better to better support issues of mental health. So I will start by saying that this facility has taken the first step, and this is by creating more mental awareness, and this is basically by doing talks every now and then. Apart from that, we can have a day a week or more where we have like a psychologist or a therapist come in, and that the the staff and the students are able to go and see him or she whenever they have any issues. Yes. But then again, I also mentioned the fact that let your neighbor be your neighbor's keeper. Yes. You should be able to tell if your friend has a problem and approach them. So it starts from the small basic things. If your friend is able to realize that you have a problem and talk to you about it, for you to maybe now realize it is true that you have a problem, or maybe just accept that, yes, I had an issue, then now maybe from there they are able to support you and help you now go to the psychologist to sort or seek further management. Yes. Yes. Pardon? Uh-huh. So we have a question on how can an organization, just repeat slowly so that I can repeat it to the people online. Mm-hmm. Mm-hmm. So the question is, how does an organization help one who keeps on colliding with others without taking any disciplinary actions? So ideally, I can give an example of what I have seen happen in the past. So for such a scenario, I will give an example of my experience. So during my internship, we had such a situation. So what the organization did was, because it was a hospital, of course it is full of doctors, so they were able to identify what the problem was. So once, if it were this organization, if you realize there's a problem, then maybe the next action will be to bring in a doctor, a psychologist, or a therapist to come and evaluate the person. If they see this is a case that requires rehabilitation or management in a mental health facility, then that is usually what happens. Yes.
You did not answer the second part of the question.
Kindly repeat your question.
I asked one question. The second part of the question. Can you give an example of various institutions and organizations that you know, certain practices that have which are mentioned and you need to stop.
Okay. So the question is, how do we stop certain organization practices that are related, that could cause mental health illness? If I'm not in management. So in terms of management, one of the things that organizations will stop in this case is maybe they need to know that, and I think maybe that is why people work in shifts. So, for example, you have an 8 to 5 shift. So clearly you know that anyone working past 5, that will be like an extra stressor for the person. So it should be one whereby you need to consider whatever tasks that the staff is or student is undergoing, like at what point do you know that now this becomes a stressor for the person, and now maybe from that point, how do you go about it? There are examples of what some examples of what I see happening is if an 8 to 5 shift is stressful to, let's say, me, then maybe I divide the 8 to 5 shift into 2. I have someone coming in till midday, then the other one during the afternoon, instead of having one person do the whole shift. So those are some of the ways that we're able to now stop the one from getting into now like the mental health illnesses. Yes. Yes. So I have gotten a question on whether there is a treatment for bipolar disorder. Yes, there is a treatment for bipolar disorder. I wouldn't want to go down into the exact treatment, but the treatment is usually divided into 2. We have medications as well as psychotherapy, and a combination of 2 is usually known to manage the illness. Yes. It's fine. Yes. So now I'm going to do a talk on mental health as well as alcohol and drug abuse. So what is a drug? A drug is any substance which, when taken into the body, will alter the body's function either physically and or psychologically. So drugs can be legal or illegal. Examples of legal are alcohol, caffeine, tobacco, and maybe the ones that you buy in the chemist. Then examples of illegal drugs, we have cannabis, cocaine, heroin, and ecstasy. So people may use a combination of all these substances, and this is usually known as polypharmacy or polydrug misuse. So there is a classification that is able to that classifies the different pharmacological agents. And so we have alcohol, amphetamines, and similar acting agents. We have cocaine, we have cannabis, we have caffeine, and hallucinogens. Then we have inhalants, we have nicotine, opioids, we have the phencyclidine or similar agents, and then we have a group that includes now the sedatives, hypnotics, and anxiolytics. There seems to be a 12th category that includes a variety of drugs that are not designated in or under the ones that I have mentioned above. And these ones include the anabolic steroids and nitrous oxide. So there are different terminologies that we are going to be going through, with the first one being drug dependence. And this is a psychological and physical state of a person that is characterized by behavioral and other responses resulting in compulsions to take a drug on a continuous or periodic basis in order to experience its psychological effect and at times to avoid the discomfort of its absence. Let me repeat. Drug dependence is a psychological and physical state of a person that is characterized by behavioral and other responses that will result in compulsions to take a drug on a continuous or a periodic basis in order to experience its psychological effect and at times to avoid the discomfort of its absence. So we usually make a diagnosis of drug dependence if one meets the criteria given below, whereby if they have any 3 or more of the following in a period of 12 months, then we can say that this person has drug dependence. So the criteria includes where one may have a compulsion or a craving, which is a strong desire to take a certain substance. We have tolerance, where one needs to keep increasing the dose for them to take to get the same effect they will get out of a substance. Then we have difficulties in controlling the use of the substance. We have a withdrawal syndrome, which is usually as a result of when you stop or reduce the amount of substance that you are consuming. Then we have relief of withdrawal, which now occurs once you take the substance. Then persistent use despite evidence of harmful consequences. So this is where you know that this is actually going to have a negative effect on me, but you're going to still, I want to still continue to use that substance. Then we have neglect of interest and an increased amount of time taken to obtain the substance or to cover it or to recover from its effects. And this is where I know I'm supposed to be at work at 8, but there's this thing that people say, like if you were out taking alcohol in the morning, unataka kufungua lock. Kutoa lock, sorry. Hata sijui. Yes. So you realize that this person, despite knowing he or she is supposed to be at work at 8 a.m., they would rather toa lock and end up like eating into the time that they're supposed to get into work. So now that is when it becomes a problem. So the reason as to why I repeated the definition of drug dependence is because people confuse drug dependence and drug addiction. So drug addiction is the repeated and increased use of a substance whereby the deprivation of which gives a rise to symptoms of distress and an irresistible urge to use the agent again, and which also leads to physical and mental deterioration. So addiction involves exhibiting a compulsive, chronic, physiological, or the psychological need for a habit-forming substance, behavior, or activity. So the difference between addiction and dependence is that addiction is a disease that is characterized by behavioral issues, while dependence refers to a physical reliance on a substance. So over time, the two conditions tend to occur at the same time, but a person can become dependent on a certain drug but not be addicted to it. So another terminology that we should know is intoxication. And this is a reversible syndrome that is caused by a specific substance, for example, alcohol, that affects one or more of the following mental functions: one's memory, orientation, mood, judgment, and behavioral, social, or occupational functioning. So this is where after alcohol intoxication, you're not able to work at your in your office properly. Yes. Then we have withdrawal, which is a substance-specific syndrome that occurs after stopping or reducing the amount of drug or substance that has been used regularly over a prolonged period. So once you're used to taking a certain drug, the minute you reduce the dose or you stop taking the drug, this is what happens. Now that's withdrawal. Yes. Then we have tolerance. So tolerance is a phenomenon in which, after repeated administration, a given dose of drug produces a decreased effect, or increasingly larger doses must be administered to obtain the effect observed with the original dose. Let me give an example. Let's say I've been having headaches, and for the headaches, let's say I normally take 500 milligrams of Panadol and it works. So 500 milligrams is one tablet. So it's usually a pair. Yes. So let's say I take one tablet and it sorts out my headache. So with time, I realize that I am taking one tablet and I'm still getting the headaches. So I increase to taking 2 tablets. Then again, with time, I realized that 2 tablets are not working. I increased to 3. So now that is what we call tolerance. So behavioral tolerance reflects the ability of the person to perform tasks despite the effects of the drug. Then we have something we call cross tolerance. And this refers to the ability of one drug to be substituted for another, each usually producing the same psychological and physiological effect. And this is also known as cross-dependent. So I will use the example of, instead of the drugs we've used, I can use the example of Panadol again, which is what you come across every day. So for example, we have Panadol and we have Maramoja. So you find out that now the same amount I'm using for Panadol, I can use the same for the Maramoja, for the Maramoja to produce the same effect that I get when I take the Panadol. So the various psychoactive substances that we take, we usually categorize them into 3. So the substance can either be a depressant, and examples are alcohol, benzodiazepines, opioids, cannabis in low doses, solvents or inhalants, and then we have new psychoactive substances that are coming in. Or instead of a depressant, it can be a stimulant. So the nicotine is what we have in the cigarettes. We have khat, which is mira, cocaine, and amphetamines, now that is, and ecstasy. Yes. Then if it's not a depressant or a stimulant, it's a hallucinogen. So this is usually where, this one is associated with where people might have now like the hallucinations. So if you take cannabis in high doses, this is what it's going to give you, as well as ketamine, and then the LSD. And then we also have something that is coming up that people call the magic mushrooms. So the national prevalence of lifetime substance use in Kenya for those aged between 15 to 24 years is at 37.1%, while the current substance use is 19.8%. Currently, alcohol and cannabis is at 17 and 5.2% respectively, compared to the Kenyan national prevalence, of which alcohol is at 11.7% and cannabis is at 1.5%. Strong evidence from studies of twins, adoptees, and siblings brought up separately indicates that the cause of alcohol abuse has a genetic component, which was what we mentioned earlier about the inherited traits. So earlier I mentioned something to do with neurotransmitters. So we usually have like neurochemical factors that are affected in this case. So researchers have identified particular neurotransmitters or neurotransmitter receptors that are involved with most substances of abuse. The opioids, for example, act on opioid receptors that we have. Then we also have alcohol and drugs. So alcohol and drugs will also increase the production of certain neurotransmitters, with a good example being the dopamine in the brain. So and when this neurotransmitter is activated or produced, it causes a nice feeling, the nice feeling that people get after taking the alcohol or other drugs. So this same neurotransmitter is the one that is responsible for addiction. So maybe we can mention something about depression and suicide. So depression is very common among people diagnosed with substance abuse or substance dependence. About 1/3 to 1/2 of all those with opioid abuse or opioid dependence, and about 40% of those with alcohol abuse or dependence meet the criteria for major depressive disorder at some point in their lives. So it has also been noted that substance use is also a major precipitating factor for suicide. So we have there are 4 major diagnostic criteria in the Diagnostic and Statistical Manual of Mental Disorders. So the substance can be alcohol, opioid, cannabis, or anything. So what you can have is a substance use disorder, for example, alcohol use disorder. You can have substance intoxication, e.g., alcohol intoxication. You can have substance withdrawal, e.g., alcohol withdrawal syndrome. Or you can have a substance-induced mental disorder. A good example can be, for example, cannabis-induced psychotic disorder. So substance use disorder is a diagnostic term applied to the specific substance use, e.g. alcohol or opioid, that results from the prolonged use of that substance. So the following points should be considered when making this diagnosis. It's whereby you have a maladaptive pattern of substance use leading to clinically significant impairment or distress, and is manifested by 2 or more of the following symptoms that occur within a period of 12 months. So the first one is where you have recurrent substance use resulting in a failure to fulfill major role obligations at work, school, or home. So you realize that it gets to a point where, for example, if you're a student, you'd rather be at a bar somewhere taking alcohol instead of attending a class. Then we have recurrent substance use in situations in which it is physically hazardous. So, for example, driving while you're under the influence of alcohol, which tends to impair your judgment while driving, and as a result, you find yourself causing an accident. Then we have continued substance use despite having persistent or recurrent social or interpersonal problems caused or exacerbated by the effects of the substance. So let's say I have a husband who keeps on coming home drunk, and clearly he knows that I am not for the drinking. So you realize this is this will be a relationship where every time he comes home, we have to argue about this. So when it gets to that point, now this becomes a problem. Then if they have tolerance, which can be defined as either a need to markedly increase the amount of the substance to achieve the intoxication or desired effect, or where you're getting a markedly diminished effect with continued use of the same amount. So this is what I said earlier. You realize if I have been taking Panadol because of the headaches and I used to take one tablet, you find out that if one tablet is supposed to make me jump around, I am taking one tablet and I am not jumping around. Or I have to now take 2 tablets for me to jump around. Then we have withdrawal, which is manifested by either of the following. The characteristic withdrawal syndrome for the substance, or the same substance is taken for me to now relieve or avoid the withdrawal symptoms. So maybe if I don't take the Panadol, I'll get the headache. Or I take the Panadol so as to relieve me from the headache, or to avoid the migraine, which might be now like a worse form of the headache that I might get if I don't take the certain drug. Then we have the substance is often taken in larger amounts or over a long period of time than it was intended. So for example, I'll give the example of the sleeping pills that one of us was mentioning. So you realize that it gets to a point where you cannot sleep unless you take the sleeping pills. So when it gets to that point, then it becomes a problem. Then there is a persistent desire or unsuccessful efforts to cut down or control substance use. So you realize that maybe per day I was taking like 5 bottles of beer. So I realized that I really want to stop, but the minute I cut down to 4 bottles or 3 bottles, I am getting maybe the withdrawal symptoms, and maybe they are coming in when they are very, very severe. So maybe if I try today the 3 bottles and I'm getting that amount of pain, then tomorrow I'm back to my 5 bottles. Then a great deal of time is spent in activities necessary to obtain the substance, use the substance, or recover from its effects. So maybe I'll give an example of alcohol. Maybe you take like whiskey, a certain brand, which might be hard to find. So you'll realize that it gets to a point where I will actually, even if I have to come from Nairobi, if the whiskey is in Mombasa, is only found in Mombasa, then I am willing to go all the way to Mombasa to get that whiskey, and then and take it, and then now maybe spend the whole of tomorrow nursing my hangover. So I said that for us to make a diagnosis that you have, for example, alcohol use disorder, you need any of the 2 or more of those 8 things that I have mentioned, but for them to have occurred in a period of 12 months, for me to clearly say that you have alcohol use disorder. Then it also now depends on the severity of the use disorder. So if you have 2 to 3 symptoms, then I will say that you have mild substance or alcohol use disorder. If you have 4 to 5 symptoms, then that qualifies as moderate. If you have 6 or more, then you qualify to have a severe substance use disorder. Then it is usually important for us to also include the fact that you might be in early remission, in sustained remission, on maintenance therapy, or if you're in a controlled environment. So now we can talk about cigarettes. So from the image, you can clearly see that cigarettes usually have various chemicals. We have nicotine, which is what we're going to talk about today, ammonia, methanol, methane, acetic acid, butane, etc., all which are very harmful. So what is nicotine? You remember I told you that psychoactive drugs or substances can either be a depressant, a stimulant, or a hallucinogen. So nicotine is usually a stimulant drug that will speed up the messages traveling between the brain and the body. And it's usually the main psychoactive substance that is used in tobacco products. And it is usually predominant in tobacco, and you can find it in lower quantities in tomatoes, potatoes, eggplant, and green pepper. So what are some of the effects that we have when we smoke cigarettes that will actually affect our health? So smoking can cause cancer, heart disease, a stroke, which is where you get a bleed in the brain. Then you have lung diseases, you have diabetes, then we have the chronic obstructive pulmonary diseases, which will include emphysema and chronic bronchitis. Then apart from causing those, it increases your risk of getting things like TB, tuberculosis, certain eye diseases, and problems of the immune system. Remember when we spoke about inherited traits? So we have some problems in the immune system that we call autoimmune diseases, with a good example being rheumatoid arthritis. There's one that some of you might be familiar with, lupus. So you find that some of these disorders, you're actually born with them, but you never exhibit the symptoms unless you get something to trigger it. It's like an allergy. Let's say I'm allergic to eggs, and I know that as long as I don't consume eggs, my allergy will not show up. So it's the same thing. So we have these autoimmune diseases that we have, like rheumatoid arthritis and the lupus, that you have, but because they've not gotten into an environment where they are triggered, they may not show up. So you can imagine you've been well all this time, and then suddenly, just because of smoking, these diseases start showing up. Yes. Then smoking during pregnancy causes premature and low birth weight in babies. It also increases the risk of stillbirths and sudden infant death syndrome. Then it is important to note that when smoking, we have toxins that are released that will damage the collagen and elastin, which are fibrous components of your skin that will keep it firm and supple. So when these toxins damage your collagen and elastin, your skin becomes hardened and less elastic, and this will lead to premature aging and deeper wrinkles. You find that a 30-year-old looks like a 50-year-old suddenly. Ukiangalia uso yake, kumbe it's just because of smoking. Then there are effects of nicotine on erection. So nicotine is known to cause erectile dysfunction, and this is because nicotine is usually a vasoconstrictor. So during the vasoconstrictive effect, this shrinks and tightens your blood vessels, thereby reducing the amount of blood that can flow through the blood vessels. So with this, you realize that one has erectile dysfunction. Then, so now we can talk about cigarette smoking and mental health. So people smoke because it heightens their mood. Sometimes it may improve memory and alertness. And most smokers say that they want to stop, but some continue because the smoking seems to relieve the stress and the anxiety. And then they also feel like they have improved memory and alertness. So, and it's usually a very common belief that smoking helps people relax. But now, with time, if one has been smoking the cigarettes for a long time, they start noticing that the more they're taking it, it's not helping them relax, and now it's giving them even more anxiety and tension. So with now the long-term effects, you realize that now smokers are more likely than non-smokers to develop things like depression over time. So what happens when you smoke? So basically what happens is that the nicotine is delivered into your system and it goes to the brain. After that, we have nicotinic receptors in our brains, which are now activated and stimulated to now release a neurotransmitter that I mentioned earlier, known as dopamine. So when dopamine is released, this is going to lead to pleasant feelings of calmness and reward. And with time, the dopamine levels will reduce, leading to withdrawal symptoms, which will now be in form of stress and anxiety. So these withdrawal symptoms are the ones that trigger one to have a desire to take another cigarette. So now with time it becomes a habit, and now with time you realize with smoking the cigarettes, you're still not able to manage your stress and your anxiety. And this now slowly leads you to things like depression. So research has shown that smoking is associated with worse behavioral and physical health outcomes in people with mental illnesses. So you realize that if you smoke for a long time, maybe you'll end up with cancer. So you realize that someone with cancer is more prone to get a mental illness simply because they feel like it's the end for them. So those are some of the things that we see happening. So research has also shown that quitting smoking is showing clear benefits for this population. Studies have shown that 30% of cigarettes are smoked by people who have mental health problems, and many of those people are not on treatment. So you realize that apart from the peer pressure that we see pushing young people into cigarette smoking, maybe one has a stressor and the only thing that calms them down is the smoking of cigarettes. So we realize that this is very common in people with other mental problems, and therefore it is important for us to address those problems so that you can stop smoking, thus preventing the long-term effects that come with it. So now we can move on to alcohol. Remember, I told you that alcohol is a depressant. So alcohol affects the brain, making you feel relaxed if taken in small amounts. But as you take more, you become intoxicated and unsteady, and therefore you might end up doing or saying things that you normally won't. And this is basically because alcohol will end up interfering with the brain's communication pathways, and that can affect the way the brain, in the long term, the way your brain looks, because your brain shrinks with time. And basically, this is what we see when we do imaging, like a CT of the head. So we realize that your brain has shrunk, and apart from how the brain looks, how it works is also affected. So alcohol makes it harder for the brain areas controlling balance, memory, speech, and judgment to do their job. And this results in a higher likelihood of injuries and other negative outcomes. So multiple studies have found a link between excessive alcohol use and damaged brain function, resulting in conditions such as dementia. So dementia is whereby, and it's something that you commonly see in the elderly, where with time they start losing memory. So you can imagine, as young as I am, with chronic alcohol use, I will have memory loss at a younger age. And these are some of the major side effects that we get from taking alcohol. Then, apart from dementia, one will also have deficits in learning and memory. They will be more prone to mental disorders and other cognitive damage. So without intervention, the brain can be permanently impaired by chronic alcohol use. So like I said, alcohol is a depressant, meaning it can disrupt the balance of the neurotransmitters in your brain and therefore affect your feelings, thoughts, and behavior. Alcohol affects the part of your brain that controls inhibition. So after a drink or two, you may feel relaxed, less anxious, and more confident. But now with time, you now become unsteady, and now you're not able to make the right decisions. So as alcohol, so it is important for you to know that alcohol abuse and mood swings frequently coexist. And this is usually known as alcohol mood swings. So alcohol abuse can cause different symptoms of mental illness, including depression, anxiety, psychosis, and antisocial behavior. Alternatively, these symptoms of mental breakdown can also occur during withdrawal. People who misuse alcohol are more likely to have bipolar disorder, which is a mood disorder. Among people with bipolar disorder, the impact of drinking is usually very noticeable. About 45% of people with bipolar disorder also have alcohol use disorder. So some of the side effects of alcohol consumption include the following. We have worsening of mental health after the calm feeling fades away, you now get this. Then we have the hangovers, which comprise of headaches, nausea, and vomiting. Then we have post-alcohol anxiety and or depression. If you binge drink alcohol, your depression and anxiety may also worsen. And binge drinking is usually when you drink a lot of alcohol in one day, which includes more than 8 units of alcohol per day for men and more than 6 units of alcohol per day for women, with 1 unit of alcohol being 500 mils of beer. So what are some of the long-term risks of alcohol dependence? So in the long term, you're at high risk of getting a stroke. You're at high risk of getting liver disease, heart disease. You can easily get bowel cancer, breast cancer, and mouth cancer. And then one of the organs that is usually very much affected is the pancreas. So you can end up with a pancreatitis. So alcohol withdrawal so withdrawal was what I mentioned was once you stop taking a certain drug, in this case alcohol, or you reduce the amount that you've been taking. So you realize when one withdraws, they start getting symptoms, and this is why and this is the reason as to why you find that someone clearly acknowledges that they have a drinking problem, but they're not able to stop. One of the major issues that we have, it's because of how bad the withdrawal symptoms are. So one can have mild or severe symptoms. So for mild, you realize that one has insomnia, where they are not sleeping enough. They have nightmares, they have tremors, anxiety, headaches. They'll have nausea and poor appetite, and they'll have palpitations that they can feel their heartbeat, as well as excessive sweating, which is diaphoresis. Then if it is very severe, then this is where you'll find one coming in with seizures. They will have very abrupt mood changes. They might have hallucinations, and in this case, they're commonly visual hallucinations that are very vivid. Then they can also have features or symptoms of dehydration. They can have hypertension, which is high blood pressure. Then the most severe form is what we call the delirium tremens, which is usually characterized by tremors, hallucinations, agitation, confusion, disorientation, hypertension, hypothermia, which is a high temperature, excessive sweating, and altered sensorium. So does depression improve after stopping alcohol? So if you abstain from alcohol for about 4 to 6 weeks, then your depression is definitely going to improve. And one will not even require medication after that period if they have clearly abstained. So those who abstain will therefore not require medication after 6 weeks if the depression was purely due to the alcohol. So at that point, if we now realize that the depression was due to another cause, then we might have to continue with the medication as we try to now find another underlying cause. So I am going to mention a few things about cannabis, so people who use cannabis are more likely to develop temporary psychosis. And by psychosis, I mean this is where one does not know, one cannot tell what is real from what is not real. And apart from that, they'll tend to have hallucinations as well as delusions. So apart from the temporary psychosis, they are likely to also develop long-lasting mental illnesses. And a good example is usually schizophrenia. So recent research studies have shown that apart from the genetic component that we knew to be the most common cause of schizophrenia, that now cannabis is also coming up as another cause of schizophrenia, which is a type of now a mental illness where people might see or hear things that are not really there. So apart from that, remember I said if taken in low doses, it is a depressant. So it is also important for you to note that cannabis also causes mood changes. Then I will end with the effects of cocaine on mental health. So cocaine addiction can occur just after just one use because of cocaine's impact on the pleasure centers of the brain. So cocaine comes in many forms, and all of them can cause long-term damage to mental health, including mood or emotional disturbances. Chronic use tends to increase specific symptoms such as hallucinations and other psychotic symptoms, especially auditory hallucinations. And apart from that, they also tend to get agitated, they have anxiety, depression, paranoia, and restlessness. So it is not uncommon for the patient to have difficulty trusting others, including the therapist if they are on cocaine. So I'd like to end my talk there and welcome any questions that you may have. Yes. So the question is, how do you help a friend or a relative who is depressed and has suicidal thoughts? So I think it is important for me to, one, mention that if anyone ever comes to you and tells you that they are having any suicidal thoughts, you should not take it lightly. So these are people that require urgent medical attention. So suicide is usually a psychiatric emergency, if I can say so. So for any person with that, it is very important for you to take them to the hospital, because this is a person that you're not even sure, if left alone, what will happen. Maybe that will be the perfect opportunity for them to execute whatever it is that they're thinking of. So it is important that if you have a friend or a relative that you suspect or who has confided in you, it is important for you to encourage them to seek medical attention, because any patient with suicidal ideation, apart from just saying it is a psychiatric emergency, this is a patient who requires admission because they have the risk of self-harm. Yes. Any other questions? Was it was it an informative session or not? Okay. Yes. Pardon? The various? Yes. Whiskey, wine. So we have a question on I have to repeat for those online. So we have a question on the various categories of alcohol, and whereby they're giving an example of busa, saying that no one, people rarely get any side effects from consuming busa. So my comments on this will be this. At the end of the day, for you to be taking alcohol, apart from the peer pressure, which is also a problem, there's usually an underlying cause. And let us not only look at it on the mental health aspect of it. We also have what are the long-term effects that we'll get. For example, the liver. At the end of the day, the various categories have different percentages of alcohol. Like whiskey might have 42%, wine might have 10 to 12%, beer has 5 to 7%. So you realize that maybe the person taking the whiskey is getting the side effects earlier from the one taking maybe the beer. And basically it's because of the percentage of alcohol that they're taking. But at the end of the day, you remember when people said hakuna mwizi mdogo na mwizi mkubwa kwa macho ya Mungu. At the end of the day, wote ni wezi. It's the same thing. At the end of the day, all these different categories, including the busa, are alcohol. And at the end of the day, we know that alcohol is a depressant. So maybe they are depressed and you've just not noticed. Or maybe they are not even aware that they are depressed. So at the end of the day, the patient still has alcohol use disorder and they need to seek help. Yes. Yes.
So where do we draw the line as like how do we know that this person is taking alcohol or this drug because of peer pressure and this one is abusing because of mental health? How do we check what is wrong?
So now that is what the doctor or therapist finds out. The only thing as a person you can find out is this person is abusing a certain drug, and that will be based on the symptoms that I showed you. That if they are not able to perform their daily duties adequately, or if they're showing up to, for example, work or class late, if they might be trying to stop, but because of the withdrawal symptoms they're getting, they're unable to, or if they have tolerance. So clearly that is what you can pick. But the stressor, most of the time, that is what the doctor is able to pick at the end of the day. For someone like a friend, it's very difficult for you to pick it up unless you talk to the person and maybe get that kind of information from them.
So at the hospital, are they taken through the abuse, the management, how to manage the situation, but they are treated, like they are given the first solution, but they just given something to manage.
So you want to know what happens in the hospital, basically. So most of the times, the patients that we get won't come at I have a problem. Most of them will either come due to effects of alcohol intoxication, if maybe the substance is alcohol. So they'll come due to effects of the intoxication or withdrawal. So it is at that point when you're managing these symptoms, like for example, seizures, headaches, nausea, vomiting. It is at that point when you're taking the history as a doctor that you realize that, okay, there is an alcohol use disorder or a certain substance, So at that point, now the management for that particular issue starts. And there are usually two components to the management. So we have the pharmacotherapy, which basically deals with medications. And then we have psychotherapy, under which we now have various forms of therapy, or rather in layman's, counseling and the other likes. So from now, the hospital, and at that point also, that's when we consider the patient as either someone that requires to be admitted probably to a psychiatric facility, or there might be one who might be having the severe forms of symptoms that will require to be managed inpatient, but in an ordinary ward. But even in the ordinary ward, as they get better, the psychologist and the psychiatrist will now start seeing them and start the psychotherapy part of the treatment.
And why do we have some majority of this after the management of intoxication, they normally get a relapse and go back to where they started?
So we want to find out why one relapses even after management. So the most important thing for this whole situation is usually the patient has to accept that they have a problem and they need to agree that they need help. Because what happens is, if I force you into the psychiatric ward, see, once you're out, you still go back to taking alcohol. So it's usually like a personal initiative from the patient. They need to accept treatment so that once they go, for example, into rehab, once they're out, they don't relapse into the behavior. Yes. Yes.
At what point do you draw the line between a session
So,
or as long as we're using alcohol?
So you want to find out when you draw the line between a social drinker and an alcohol abuser. So there were some symptoms that I mentioned earlier. Maybe we can go through them again in summary. So the difference between a social drinker and a alcohol abuser is that now the alcohol abuser, you'll notice that they'll start, they're not able to fulfill their day-to-day work. So they have impairment in their social and occupational functioning. Then apart from that, you realize that this is someone who is even willing to drive or maybe operate any form of machinery under the influence, which ends up endangering him or herself. Then apart from that, they have so it's basically these things. They have arguments with the spouse about consequences of the intoxications, or maybe now he starts coming home drunk and having a physical fight with the other family members. They have tolerance, withdrawal, and now there is, as much as he or she wants to stop drinking, they're unable to cut, or they're not successful because of the side effects that come with stopping or reducing the amount that they've been taking. So those are some of the things that will now make you draw a fine line between a social drinker, of which we have people who like going out on Friday. So as long as by Monday you've already nursed your hangover and you're back to work and you don't do it every day, that one becomes a social drinker. But there's this one who has the urge to drink almost each and every day, and you realize that the things happening around him, surely there's a problem. Yes. Yes. Mm-hmm.
There's another aspect so why should we have this state of things? Why is it
So the question is my opinion to the government in terms of whether they should do away with the alcohol and other substances or not. So my honest opinion will be, let us not get to that point where we need to have someone look after us all the time. For example, if I know that nikikunywa more than glass moja kutaanza kuharibika, why should I? Because you see, if I am to address I am in no position to say whether we should do away with it or not. But what I can say is that we need to have that, you need to know what is good for you and what is bad for you, and then now act from there. If I know my friends and I go out every Friday and nikiangusha chupa moja kutaharibika, then you avoid. So it has to come from within, because mimi chupa moja itaniangusha, but maybe for Lois it takes her 10 bottles for yeye imwangushe, you see. So it's up to you ujijue. Nikitoka hapa nikienda na marafiki wangu, mimi it's not more than 1 bottle. And that is my opinion. I cannot really comment about the government on what it can and cannot do. Yes, because even, for example, like cigarette smoking, we usually have like adverts on TV, but they clearly indicate that smoking is not for anyone under the age of 18, for example. But when you go out there, you'll see someone who is less than 18 years old, but consuming the drug, so the substance. So you realize that it's up to you. You need to know who you are and what you stand for and what will affect your health. If you've been given this information, you need to take it in and now find out what is good for you and what is not, then now act from there. I don't know whether that answers. Okay. Any other questions? Then at this point, I'd like to invite Lois, yes, to come and tell us a few things.
Good morning once again. Thank you so much, Dr. for that presentation. I hope we have all learned something. And we are happy that myself I've learned a lot. And if you have any other questions, feel free to talk to Dr. before she leaves. So I'll just talk briefly about Avenue. I can see you have reduced. I'll be fast. I don't want to bore you guys. I know it's tea time. So I'll be very fast. Just to mention a bit about Avenue Hospital. I know most of you know Parklands Hospital, and you don't know that we have so many other branches all over. So basically, Avenue Group is divided into 4. We have Avenue Hospital, which is consists of 3 fully fledged inpatient hospitals. That is the one in Parklands. It's the most common. Another one in Kisumu and in Thika. So those are our 3 inpatient hospitals. So they have both outpatient and inpatient. We have theaters, we have maternity. They are fully fledged hospitals. And then we have Avenue Healthcare, which consists of 13 clinics. We have 13 outpatient clinics, which are distributed all over. And the one that is nearest to you guys is in Rongai. It's at the one in Rongai is at Masai Mall on 2nd floor. In case maybe you want to access any medical treatments and you're around this area, you can visit our Rongai branch. It's at Masai Mall. We also have a branch in Langata. We have in town, Gong Road. Gong Road, we are at Greenhouse. In town, we are at Loiter Street. at the former Barclays Plaza. Right now it's called APSA. We're also in Garden City. We are at Greenspan. Greenspan is a Donholm area. We are at the Greenspan Mall. We're in Buruburu. We are in Embakasi. Then in Kisumu is a hospital. Then we are also in Eldoret. Maybe for someone who would have maybe in the home and you're around. You're outside Nairobi. We have a clinic in Eldoret. We have a clinic in Mombasa, Changamwe, and Nakuru as well. Also, we have Avenue Home-Based Care. This is whereby maybe you have an elderly person at home and you don't want them to go to the hospital to be taken care of at the hospital. We have a home-based care whereby you engage us to get you a nurse or a nurse aide who will come and take care of your elderly person or sick person from the comfort of your home. Also, we have rescue services. I'm sure most of you have seen our ambulances all over. This consists of our medical taxis and fully equipped ambulances. In case of any emergencies, you can call us for any emergency services. Our ambulances and medical taxis are always available. Yeah, so in our clinics we have specialist clinics. We have the physicians. We have gynecologists. We have pediatricians. We have physiotherapists in all most of our clinics actually. But if you need any case that needs admission or maternity, you'll find them in our hospitals. That is in Parklands, Thika, and in Kisumu for those who are outside Nairobi. So I think that's it about Avenue. Also, we have wellness packages. I don't know if you guys have an insurance cover whereby you find that you have a wellness package aside from the outpatient cover. There's a wellness package whereby you can go just even when you're not sick. Nowadays it's good to know rather it's good to have that checkup at least once a year. Like for the women, it's good to have a pap smear. For the men, it's good to have a PSA, which checks the prostate, because these are the cancers that are very prominent as of now. So if you have that wellness package, please pass by any of our clinics or hospital and have a wellness checkup. You will be advised, because mostly they vary depending on age and gender. You'll be advised which one is good for you. The package has various tests that you'll be advised that is beneficial to you, depending on your age and gender. So I think that's it about Avenue. If you have any questions, sorry. Yeah. So psychology clinics. We have a psychologist in town, and we have the one that I'm sure of is in town, and our psychologist is called Dr. Ambayo, and you will find him at APSA Towers. In case you have any issues in regards to what Dr. has talked today about, you can visit our town clinic, and you'll be referred to our psychologist, who is called Dr. Ambayo. Yes, I think that's it. Unless you have any other questions. Thank you so much.
I just want to tell you to answer one question from someone doing up on YouTube, asking if does vaping help in quitting smoking and maybe same sex?
There's a question on whether vaping
helps in quitting smoking
and whether it has any side effects. So I don't know I am not sure whether vaping is part of the shisha thing, but if it is, what we know so far is that smoking shisha is similar to consuming 100 cigarettes at a go, making it far much worse than the cigarette smoking itself. So the answer is no, it does not help quit smoking, and it definitely has side effects.
Alcohol is smoke is and a lot of smoke
So they may say smokeless, but whatever it is that you're taking in is tobacco and nicotine, which has a higher content by 100 times than what you get in a cigarette. That is what I will say. Yes.
Remember, we come to the end.
We've come to the end of the sensitization. Thank you so much for attending. For our viewers online and those on following us on YouTube, thank you so much for creating time. And also for the members online, thank you so much for coming. Members online, you're welcome. I mean, physical, you're welcome for a cup of tea outside. I wish you the rest of the day that you enjoy the rest of your day. Have a good day. Bye.
Kwenye wanapita. Nani aliwaambia?
Yeah.